What's going on, guys? We have made it to 6 months post hair transplant, and finally we are here. As you can see, we got these little micro bangs going on here. Seen a lot of progress over the last couple of months, and I'm super excited that we're finally into the fun part of the hair transplant where we actually get to see results. 6 months ago, I ended up getting a hair transplant in North LA with Dr. Parso Mahibi. He did a very good job, him and his team, taking care of me. It was a 2-day procedure, and we got 4,126 grafts. The last few months were not the best. We got them placed like everywhere on my head. We put more towards the front and to the side, and then we had some scattered through the middle, and then we put more density in the crown. Basically, I'm going completely bald. So we needed a very specific procedure to get enough coverage to cover all my bald spots and kind of create this illusion of a full head of hair without having a full head of hair. And yes, on top of the hair transplant, I'm still taking medication, finasteride, minoxidil. I microneedle. I use tretinoin in combination with minoxidil. So I still have a hair growth and hair loss protocol that I use every single day on top of the hair transplant before the procedure and post procedure. That's just the reality we live in. If you guys are planning to get a hair transplant and you guys are still balding, make sure you stop your hair loss first before you go into the procedure, because you're still going to be balding after the hair transplant, right? If you put transplanted hairs on the spots that you need the hair, but then the hair continues to recede or those native hairs continue to go, that transplanted hair isn't going to be enough to give you the coverage that you want, and you're going to look just as bald as you were before years down the road. Hair transplant's kind of like a band-aid. It doesn't really solve the issue of hair loss. So make sure you guys are doing everything you can to stop your hair loss first and get on some type of protocol. That way you can just have a full head of hair and not keep losing your hair, because when your hair starts to go, it starts to go. Personally, the experience, it's been up and down. I mean, super excited getting the hair transplant, super excited to get everything going. The first month was great. You get to see all those transplant hairs come in, and a lot of them actually stayed. Looked like I had a buzz cut, and I was loving the look. And then month two, I had the classic dread shed that everybody through hair transplants are going to know about, where you basically lose all those transplanted hairs. You also have shock loss, and those native hairs go away too. So I basically went from having a baseline of hair to actually looking worse than I did before the procedure 2 months into the post procedure. 2 months in, man, my hair's falling out. It looks all patchy, looks sparse. I got a lot of hair falling out. And I just owned it, honestly. I just didn't really care. You can't go outside for more than 5 minutes to have any sun damage to the grafts that you just had. So you make sure you wear a hat outside. So if you guys are worried about wearing a hat or not after your hair transplant, you can wear a hat. You can cover it up until that hair goes back in, because I know you do not want to be walking around with a fresh hair transplant showing people what it looks like. Because if you didn't like your hair before, you're not going to like your hair 2 months post hair transplant. After month two, month three, it got worse. I decided not to cut my hair. At this point, a lot of people decide to buzz down their hair, which honestly I would recommend. The only reason I did not buzz down my hair is I genuinely just wanted to show you guys what the hair looks like as it starts to grow back in. Buzzing it down is a great way to go, because it doesn't even look like you had a hair transplant for most people, and you can kind of blend in all the hair, just keep it short. And then by the time it hits month six, then you could start growing it back in, or month five, or whatever it is. Month three into month four, I started noticing all those mini micro hairs coming back in and bursting through the skin. Month five was a very pivotal point in the transplant process, where those hairs start to come in, get thicker. And now that we hit month six, the last 2 weeks, so the back end of month five, has been the biggest change I've seen. When we did the procedure as if I'm going to style my hair left to right. I've always styled my hair left to right, so it was just normal to me to style it left to right. And this also allows us to place the hairs in specific spots we need them for specific coverage. So, and angles of the hair. So people and surgeons will actually put hairs in a certain angle so that they can lay down a certain way. So when we did the procedure, he put the hairs in this way so the hairs can comb over naturally. And then these hairs were that way as well. So they can kind of curl back over, and I can get this like swoop left, swoop right, kind of push back kind of look. Now it's not complete, obviously. It looks pretty raggedy right now. I have no product in it, so I have to style it. But hair transplants are basically an illusion. And this is my next point I want to get to, is expectation. So going into it with expectation of a hair transplant, I'm thinking a one and done process. Let's just get 4,000 plus grafts. Let's cover the scalp. Let's put a new hairline in. Let's get the crown. And 6 months down the road, I realized that if you set expectations too high, you're going to be disappointed with them. with the outcome. And if you set them too low, you're not going to be motivated to go get a hair transplant. So if you're going to get a hair transplant, you're going to have more hair than you had to start, and it's going to look awesome. If you have the money to go do it because you will love the outcome. Already will love the outcome. Just don't get botched or don't have a failed hair transplant. That's going to come down to your protocol and finding the right doctors. Stopping your hair loss, make sure you have a hair routine, finding the right doctor, getting a good procedure. I went through a friend, his name's Melvin. He runs the Hair Transplant Network. It's a forum online. You could just go to it for free, find a doctor that's in your area, click on doctors maybe you want to see or an area you want to go to, click on the doctor and it'll show realistic patients, realistic results, before and afters. You're going to want to find a doctor that has procedures similar to your hair style or your hair issue. For me, we went conservative, kept the hairline a little bit higher, built in some density, blended in the hairline with the diffuse stem look. So that has this like really just mature, natural look. And that's just what I wanted. I have more grafts in the future when I continue to bald, if I want to go back in and fill in some patchwork or maybe some temple work or whatever. But overall, he did a great job. Know if you're going bald that it's not always going to be exactly how you wanted it as you imagined it, of this perfect Fabio, beautiful hair that you had when you were 18 or hell, 16. Some people start balding at 18. I started losing my hair at 18. You're not going to have like this perfect look. And that's just if you're going like completely bald. It's going to be hard to get exactly what you want, especially if you're going bald. You have crappy hair genetics, that hair is miniaturized, it's thin. But there is realistic results for people that want to go get hair transplants to just fill in the hairline. Imagine this, right? I want to talk about density and like your expectation and how many grafts to have it look a certain way. And this is going to be like very in depth for people that like, I remember watching hair transplant videos. I'm just yapping right now, but I'm giving you guys good information. So I want you guys to hear me out. If you guys are planning to get a hair transplant, you can imagine getting 4,000 grafts. Okay. Basically, people are limited to grafts they can get from hair transplants. It could be 6,000, 7,000, 8,000. Some people get 9,000. It's basically you're limited to the amount of donor hairs you have from the sides and back of your head where the hairs are DHT resistant. And that's why I say take medication, because you want to stop DHT from attacking the top of your hair so that those hairs won't miniaturize and you won't lose them. If the goal is to keep hair, then you would get a hair transplant and take medication to have the fullest look possible. Regardless, you could still go into the beard and get some beard hairs. I can get like another 1,500 grafts in the beard hairs, so on and so forth. But most people in one sit down surgery get around 4,000. The reason that because you don't want to do mega sessions. When you do mega sessions, it's like when you get like 8,000 plus grafts. Imagine taking all your grafts, putting them on your head, all that inflammation, all that trauma. Maybe all those transplant hairs don't stay, and then you're like, shit, the hair transplant didn't look as good or didn't turn out as well. Well, now you're out of grafts. So it's really good to just go in with like not all your eggs in one basket, max 4 to 4,500. Some people do like bigger sessions, like 6,000 grafts, which you can do as well. But what I would do for the long run is I would get max like 4,500 grafts on your first session. And if that doesn't give you the result you want, at least you have more reserve to go back into to fill more density. But if you get 4,000 grafts, your hairline's going, and you put that all up front, you're going to have this crazy dense look in the front, right? Myself, I took 4,000 grafts and basically scattered them and placed them throughout my entire scalp because I'm a diffuse thinner. So you might look at my hair and go, well, it doesn't really look that good. Well, we disperse that density look for coverage. There's a difference between density and coverage. Density is the amount of hairs that's packed in a single place. Coverage is like your illusion of coverage of the scalp. So like for me, I have coverage, right? Like I have hairs here that can cover over some of these dead spots here. I have hair in the crown that can spiral. So you do the crown, they surgically put it in this spiral technique that places the hair that's spread over the crown, back of the head, over the scalp. On the front, obviously, we talked about this strip of density that goes here, so we can brush it back and cover some lower density pieces in the scalp. So basically, we have this flow of hair that's having good coverage for someone like me that needs the coverage. Now, if you want density, like your hairline's just going, you could just pack 4,000 grafts up front and you would just have a full dense look. And you're probably looking at people that get hair transplants, that get transformations like that. And you're like, wow, holy crap, that's crazy. Like that looks great. Like that's what I want. And you can do that. And I would be super jealous. That's awesome. Do it. But if you're going completely bald like me, you're going to have to sacrifice some parts of what you want for the overall look, if that's what you're going for. And so that's kind of what I was getting at, is that I just want freaking crazy amount of hair everywhere. But a transplant isn't going to be able to provide me that with the donor hairs I have and how bald I'm going. So I can't have this like over the top expectation of like I'm just gonna have like this amazing full thick head of hair and I'm gonna get braids, right? Like it's just not gonna happen. These last 6 months, a lot of ups and downs. If you get a hair transplant, and you should expect to see results 4 or 5 months in, right? But then you start taking topical minoxidil at month 2 and you go through a shed and then that hair loses until month 3 and then that hair starts to come back by month 4, then you might be seeing results by month 7 or 8. It's going to be a better result because you're using topical minoxidil if you're a responder, but that result's going to come in a little bit delayed. So right now for me, my result is just a little bit delayed and I've seen it in the last 2 weeks where my hair just looks completely different than it did last month. I get frustrated, and that's why I tell everybody to take update photos once a week or update videos because you look at your hair and you're like, damn, I'm not seeing progress. And then you go back a month ago and you're like, wow, I see a difference. Or 2 months ago, you're like, oh my gosh, it's a big difference. It's okay. It's still going to come in. So only starting month 6, and I am super optimistic for month 7 and 8, knowing that I've only seen big change personally to my look and the aesthetic of the hair, the girth of the hair. That's what she said. The thickness, the texture, only in the last 2 weeks. All my issues with the hair transplant, and this is that expectation piece I was talking about, is the strip of hair up front. That's awesome, but I do have like this like pockets, right? Like here is a little bit thinner. The crown is a very tough one to do. If I was to scrape my hair apart here, you could see little pockets, right? But overall, man, it's been really, really good. I've never had this much hair in the last 7 years. So pretty crazy to see it on my head and see that look. If you guys want a sign to get a hair transplant, I hope this is it. This is the first time in years where I've gone to the gym, gone outside, and haven't really cared. Feel normal. I feel like I don't like always, hey, does my hair look like shit or does it look bad or am I bald? I don't really think about those things anymore. I just feel like I feel normal. If you have any questions, drop them in the comment section below. I'll be happy to answer them for you. And I'll be making more YouTube videos consistently for you guys soon. If you guys want to drop a like on the way out, and I'll keep you guys posted. Love y'all. Peace.